When an individual stands accused, society wants to know one thing: will they do it again? The legal system demands a simple yes or no regarding their dangerousness. There is a widespread expectation that psychological evaluation can provide a definitive, error-free forecast of a person's future actions. In high-stakes environments, these evaluations dictate whether a person walks free, is sent to a psychiatric facility, or faces preventative detention. But predicting violence with absolute certainty is a scientific myth. Categorizing people strictly as dangerous or safe has a long history of failure. Clinging to a binary prediction model actually jeopardizes public safety. It ignores the fluid, probabilistic reality of human behavior. Instead, the field has adopted a framework known as the Risk Assessment and Management Model. Under this framework, violence risk is not viewed as a fixed or innate personality trait. It is highly dependent on anticipated conditions, external circumstances, and environmental context. Risk varies along a fluid continuum, rising and falling based on immediate stressors. The forensic psychologist's job is not to prognosticate an event, but to evaluate these shifting variables. The ultimate goal is to actively manage the probability of specific behaviors under specific conditions. Historically, the field relied on what is known as unstructured clinical assessment. In this approach, professionals' conclusions entirely on human intuition, unstructured interviews, and subjective judgment. But relying on intuition is highly problematic when evaluating something as complex as violence. It suffers from low inter-rater reliability, meaning two clinicians examining the same patient often arrive at vastly different conclusions. Subjective judgment is also vulnerable to cognitive bias, where irrelevant details in a case narrative inadvertently skew the evaluator's interpretation. To correct this, researchers developed structured professional judgment, or SPJ, which gives evaluators empirically based factors to focus on. They also developed actuarial tools, a data-driven approach based on statistical algorithms. This diagram shows how these assessment methods stack up in discriminative accuracy based on meta-analysis data. As we move up the pyramid, actuarial methods reach an AUC of 0.657, a moderate predictive accuracy. They statistically outperform clinical judgment by replacing subjective intuition with structured formulas. Systematically weighting variables provides a more consistent framework for translating a person's history into a calculated risk profile. A prime example of an effective structured professional judgment tool is the HCR20 version 3. This tool is used for decision-making regarding violence risk in correctional, civil psychiatric, and forensic settings. It organizes the complexities of an individual's profile into distinct, measurable categories. The first major category evaluates static risk factors. These are historical, entrenched background conditions that cannot be changed. They include empirical metrics like a person's age at their first violent act or their established criminal history. Severe childhood trauma and psychopathy also operate as permanent static factors in a patient's profile. The second major category evaluates dynamic risk factors. This matrix compares locked static factors on the left with dynamic fluid conditions on the right. Dynamic factors include variables like active substance abuse or psychotic symptoms. When an individual stops medication or experiences relationship instability, these sliders move, indicating increased risk. Strictly separating these elements is critical. Static factors establish an unmoving baseline of risk, while dynamic factors reveal actionable targets for clinical intervention. Evaluating an individual also requires identifying the exact timeframe of the threat. This timeline illustrates why professionals distinguish between long-term risk factors and acute warning signs. On the far left, risk factors sit as foundational blocks, representing underlying long-term vulnerabilities. They establish a probability of future violence, but offer no exact timeline. Moving to the middle, situational triggers are external events that suddenly activate those vulnerabilities. On the right are warning signs, time-sensitive indicators of an immediate concern. Warning signs are observable actions indicating an acute, urgent risk within minutes, hours, or days. One specific warning sign that demands immediate attention is communicating suicidal or violent thoughts, either verbally or in writing. Another is actively seeking immediate access to lethal means, such as firearms or large quantities of medication. A third is demonstrating preparatory behaviors, like suddenly putting affairs in order. For law enforcement and clinicians, the difference is clear. Risk factors dictate long-term monitoring, whereas warning signs require immediate physical interdiction. Even with the best data, where do these structured models hit their mathematical predictive ceiling? A major meta-analysis of risk assessment tools measured their negative predictive value, or NPV. Structured tools boast an 81 to 95% negative predictive value, accurately clearing low-risk individuals. However, the high-risk group's positive predictive value is much lower, with a median success rate of just 41%. This reveals an inherent clinical difficulty, pinpointing the exact individuals who will commit violence without sweeping in a large number of false positives. The mathematics show these tools are exceptionally good at identifying who is safe, but limited in isolating exactly who is dangerous. These statistical realities reframe the true value of a violence risk assessment. The assessment is a rigorous, objective synthesis of a person's history, current clinical state, and acute behavioral markers. By mapping these variables, professionals can move past subjective guesswork and build targeted, effective management strategies. While the myth of absolute prediction is exactly that, a myth, the rigorous mechanics of risk management provide our most reliable path toward public safety.